Winter has been one of the warmest on record, and that means a worse than average tick season is ahead. Ugh. So here to talk about it tonight, we're talking about Lyme disease, is Dr. Beth Collins. She's double board certified in plastic and reconstructive surgery. So glad you're with us tonight.
Nice to see you.
We're already hearing an alarming thing that already the Connecticut Agriculture Experiment Station is seeing a staggering number of ticks with Lyme disease right now in the winter.
Yeah, isn't that awful?
People hear about that, and Lyme disease can be really debilitating.
It sure can, yeah. And the tough thing about it is that the symptoms are often very vague. So you may get headaches and mild fatigue, joint pain, and they masquerade as other diseases. So sometimes it's a little bit difficult to diagnose.
So first of all, the obvious thing would be you get bitten by a tick.
Right.
But it's not just any tick bite. It has to be a tick that's already infected with Lyme disease.
That's right.
So let's say that happens. You have a tick on you. You're able to get it out. How soon, if it was an infected tick, would you start feeling those symptoms of Lyme disease?
It can range. First of all, the good news about that is if you are bitten by the tick really has to stay attached from anywhere from 24 to 36 hours to transmit the disease. So it is actually a little difficult to get. But let's say you get it. It can take anywhere from 3 days to a month to start seeing those first symptoms.
So that's why you're saying it's so difficult, because if you started to feel feverish, you might not even remember the tick bite that you got a month ago to put two and two together.
Exactly, and in addition to that, some of the tests they do on the blood are not really that specific, and sometimes it's hard to detect even that way. So we go on a clinical diagnosis based on exposure to a tick. So if you know you had the tick and then you show up with some of the symptoms, so those being that bullseye rash that you hear about all the time. It's really dark in the center, and then normal, and then another ring of red.
Would it be where the tick was, or can it appear anywhere?
At first it's where the tick was, but after the disease starts to go through the blood, it could show up on other places on your body. So that's one of the first signs. If you see that and we're exposed to the tick, then we make the assumption that you've got it. And then it progresses on a little bit as the disease spreads throughout the blood, and you could get in joint pain, fatigue, and if you really let it go without treatment, it could get quite serious. You could go on to get heart arrhythmias and a lot of neurological signs.
And it's so important to act quickly, so even if you suspect it, right, because timing is everything for treatment?
That's true. Some people will say if you were exposed to a tick, to take just one dose of doxycycline just to ward off the disease. That's an antibiotic that they would give to treat the disease. But there's not a lot of good evidence that that really works very well. So if you are bitten by the tick and you take the tick out, just watch yourself, let your doctor know that it's happening, and look for those signs.
Obviously, the basics in protecting yourself is to wear mosquito repellent, tick repellent.
Tick repellent and mosquito repellent. There's a separate tick repellent that you could spray on your clothes that is different from the DEET, so those things together will help ward off the ticks. But really, it's about looking at yourself. So we know right now we're going to have a high volume of ticks. So every time your kids or yourself or anybody is outside for a long period of time, or your dog comes in and they have a tick on them, look at your whole body, look in your scalp, look under the arms, in places you wouldn't really expect it, and see if there's one on you.
Okay, great advice. Great to see you again tonight.
Nice to see you.
Thanks for coming in.